Good afternoon, everyone. Welcome to the Tele-Health Education for Your Health Awareness Campaign Talk Series, the FACT Initiative for 2020-21. This is an inaugural virtual public health education program, which is an academic community partnership brought to you by the International Community Initiative, the Maryland Rural Health Association, and the University of Maine Eastern Shore School of Pharmacy and Health Professions. It is my honor to serve as your host this afternoon for our second in the series of the second episode. A little bit about the organizer and the partners of the FACT initiative. You can see our mission of the International Community Initiative, the Maryland Rural Health Association, and the UMES School of Pharmacy and Health Profession are listed on the screen. In the interest of time, we invite you to visit our website as listed on the screen to learn a bit more about our programs and activities. The mission of the FACT initiative is to promote healthy habits and raise awareness through an interprofessional collaboration and telehealth delivery of health information for the community. Our goal is to provide accurate health information, resources, and strategies based on selected health topics of the National Health Observance to promote health and prevent disease. This includes a monthly 30-minute telehealth education episode starting in September and presented by a variety of healthcare individuals for the public. For more information and or to volunteer for this program, please contact myself or our partner, Ms. Lara Wilson with the Maryland Rural Health Association. As I mentioned, we launched our first episode last month, and today will be the second episode. Our program for today is having Dr. Oyalowo as the speaker. Last month we had about depression, older adults, and COVID-19 with Dr. Shane Saunders. So today, in celebration of Breast Cancer Awareness Month in October, we have our speaker, Dr. Marie-Therese Oyalowo. The topic for today, as mentioned, is breast cancer awareness, what we need to know and do to prevent. I would like to present to you Dr. Marie-Therese Oyalowo. Dr. Oyalowo is a board-certified oncology pharmacist, an associate professor and director of drug information at the University of Maine School of Pharmacy and Health Professions. She has over 30 years of professional practice experience as a nurse and a pharmacist with more than 20 years in the area of oncology. She has taught, conducted research, and presented on oncology topics for many, many students over the years. Please help me welcome Dr. Oyalowo.
Thank you so much, Dr. Trong, for that great introduction, and also for inviting me to present on this topic, which is very dear to my heart. As provided on this outline, I'm going to be providing you with an overview of breast cancer, causes of breast cancer, risk factors, preventive strategies, which include screening recommendations, preventive mastectomy, lifestyle modifications. Towards the end of the presentation, I'll also provide you with some useful resources which can be used for both educational purposes and also for providing services needed by your loved ones or yourself should any one of you be diagnosed with breast cancer. I'll also, at the end of the presentation, provide you with some take-home messages. Breast cancer is one of the most four common solid tumors documented in the United States. And it is caused by several factors, both endogenous and exogenous. It is a heterogeneous disease that is caused by a progressive accumulation of defects in genes. Therefore, it's characterized by formation of malignant cells in the breast tissue. Please note that 1% of new cases of breast cancers and death occur in men. As you can see from this slide, 5-year survival of patients that are diagnosed with breast cancer is greatly improved if the cancer is diagnosed early. This slide also just supports the fact that I mentioned earlier about early diagnosis, and that is where screening is going to be very crucial in ascertaining that the cancer is diagnosed early enough to improve survival. As you can see from the slide, when the cancer is diagnosed and it is still localized, that it hasn't spread to other parts of the body, the 5-year survival chance is 99%. So how common is this cancer among the female population in the United States? And which population gets affected most? While breast cancer can occur in any race, ranging from white, black, Asian, Hispanic, non-Hispanic, American, Indian, I would like to draw your attention to 2 racial groups, the white and black population. If you notice from the table on your left, the incidence per 100,000 persons in this for diagnosis of breast cancer is higher in white females than black females. However, the death rate is higher among blacks than the whites. Thus, the phrase disparity in cancer care is often used to describe this scenario. Socioeconomic factors have been suggested as one of the reasons for this disparity. So, female breast cancer, who gets this cancer in terms of age groups? This cancer can occur in age group between 20 to greater than 84 years of age. However, breast cancer commonly affects the older population, ranging from ages 55 to 64 years of age. The median age at diagnosis is usually around 62 years. Although breast cancer has been classified differently based on aggressiveness of disease, I've provided you a classification here that is based on the location of the breast cancer. As you can see from the anatomy of the breast provided in the figure to the right of the slide, please note where the lobes are indicated and the ducts. Also, the nipples is important to note because there is also a form of breast cancer, which I'll mention later on, that affects the nipple area. Ductal carcinoma and lobular carcinoma shown on the slide is further classified as in situ, which means it's localized, or invasive. The most common form of breast cancer, which occurs in majority of the cases, is invasive or infiltrating ductal carcinoma. Now, inflammatory breast cancer is just a form of ductal carcinoma. As I mentioned earlier, you will hear the name Paget's disease, which describes a form of breast cancer that affects the nipples. Please note that breast cancer is also classified into stages 1 to 4, with stage 4 being the most aggressive form, involving metastasis or spread of the disease to other parts of the body, such as bones, lungs, and the central nervous system. So what type of symptoms are usually presented by someone with breast cancer? As you can see from the description of the first symptom, painless mass. This is reported in about 90% of the cases. So there are still those 10% of cases that may report painful masses. Please do not listen to the misconceptions that when the mass is painful, it must be benign. Always seek medical attention if you notice an unusual mass or lump, whether painful or painless. Other symptoms that are listed include stabbing, aching pain, nipple dimpling and discharge, palpable regional lymph nodes, and when the disease has spread, bone pain, shortness of breath, jaundice, and change in mental status. What are some of the reported causes of breast cancer? As I mentioned earlier, breast cancer results from progressive accumulation of genetic mutations or defects, most of which are somatic or acquired in nature. Germline or inherited mutations occur in about 10% of patients. These defects result in increased growth and enlargement of breast tissue, changes in normal appearance, then carcinoma in situ, and eventually invasive cancer. Estrogen and progesterone hormones or progestin hormones, whether produced endogenously or administered exogenously, promotes the growth of these breast cancer cells. To fully understand the development of breast cancer, there are several risk factors that promote its growth and proliferation. Although some of these risk factors are non-modifiable, well-conducted studies have shown that there are recommendations that, if followed, would decrease the incidence and mortality from breast cancer. Let's look at some of these risk factors. I have divided here both non-modifiable, and those are risk factors that cannot be changed, and modifiable, those that can be changed. Let's go through the non-modifiable first. Female and age, the two most important risk factors, those are non-modifiable risk factors. Additional non-modifiable risk factors include personal history of breast cancer, personal history of benign breast disease, family history of first-degree relative with breast cancer, such as mother, daughter, or sister, inherited changes in genes such as the BRCA1 or BRCA2 genes, or other genes that have been linked to breast cancer. And I can tell you this, there are several other genes linked to breast cancer. Dense breast tissue on mammogram, menstruation starting early before the age of 12 years old, and menopause that starts at a later age, greater than 55 years old. Now let's look at some of those risk factors known as modifiable, and these are risk factors that can be changed. Alcohol use, overweight or obesity, physically inactive, not having children at all, or having children at a later age, or also having the first child at an age greater than 30 years old. Some literature sources will tell you greater than 35 years old, but this is a modifiable risk factor. Not breastfeeding is another modifiable risk factor, or a risk factor that can be changed. You can opt to breastfeed or counsel, provide education for those young mothers to breastfeed. Other risk factors include contraception, hormone replacement therapy, breast implants, and radiation to chest. As we are celebrating Breast Cancer Awareness Month in October, we cannot overemphasize the importance of screening using mammography. Before I go on to discuss this slide, a note about self-breast exam and clinical breast exam. The American Cancer Society and other organizations involved in providing clinical guidelines do not include this test in their guideline as a result of research not showing any clear benefit. This does not preclude women from still performing the self-breast exams or providers the clinical breast exams. They are just not providing any recommendations on routine testing. In fact, healthcare providers may still offer clinical breast exams in high-risk individuals. I'd like to emphasize this part by actually reading some information from the American Cancer Society, word for word. Research has not shown a clear benefit of regular physical breast exams done by either a health professional, which is clinical breast exams, or by women themselves, breast self-exams. There is very little evidence that these tests help find breast cancer early when women also get screening mammograms. Most often, when breast cancer is detected because of symptoms such as a lump, a woman discovers the symptom during usual activities such as bathing or dressing. Women should be familiar with how their breasts normally look and feel and should report any changes to a healthcare provider right away. While the American Cancer Society does not recommend regular clinical breast exams or breast self-exams as part of a routine breast cancer screening schedule, this does not mean that these exams should never be done. In some situations, particularly for women at higher than average risk, for example, healthcare providers may still offer clinical breast exams along with providing counseling about risk and early detection. On this slide, recommendations are provided based on risk stratification. The guidelines presented here are based on American Cancer Society recommendation, which are supported by other organizations as well. Please note the differences in recommendation between average risk and high-risk breast cancer. For average risk breast cancer, with no personal or strong family history, no genetic mutation that will increase risk of breast cancer, or if, for example, BRCA gene, no radiation therapy before age 30. The recommendation here is to provide an option for women between ages 40 and 44 to initiate yearly screening with mammogram. Yearly mammogram screening is also recommended for patients ages 45 to 54 years of age. For women 55 years and older, they have a choice to obtain yearly mammograms or every other year mammogram. Screening is recommended to continue if the woman is in good health with a life expectancy of at least 10 more years. For high-risk breast cancer, the risk described as follows: lifetime risk of approximately 20 to 25% or greater, first-degree relative with a BRCA1 or BRCA2 gene mutation, previous radiation therapy to chest between ages 10 to 30, diagnosed with various syndromes as listed here. And those syndromes some of these syndromes are related to mutations in the tumor suppressor gene. The recommendation for this high-risk category is for women to get a yearly mammogram with an MRI beginning at age 30. For women with a lifetime risk less than 15%, American Cancer Society does not recommend MRI screening. So, what are some of the breast cancer preventive strategies that have been recommended and actually documented in literature as well? As the title of this presentation indicates, what can we do to prevent? This slide provides recommendation on preventive strategies. These include maintaining a healthy weight throughout life, increased physical activity, limiting or avoiding alcohol intake, avoiding combination hormone therapy, genetic counseling and testing, drug treatment with selected drugs that work towards decreasing the amount of estrogen in the body, and of course, surgeries, which are usually would be performed by the physician or the oncologist. And those include prophylactic mastectomy or prophylactic oophorectomy or ovarian ablation. In terms of maintaining a healthy lifestyle, you must know your BMI, which is the body mass index. As you can see from this chart, the green color indicates somebody that is living a healthy lifestyle. This slide provides you with some ranges of what is of the classification of healthy all the way to obesity. So if the body mass index is between 18.5 to 24.9, that's considered a healthy value. And any value above 30 is considered obese. So, what is the recommendation for a healthy diet? With a healthy diet, according to the American Cancer Society, a diet with emphasis on plant food, limiting red or processed meats. An example of processed meats are things like your bacon, your hot dogs, and increasing amount of fruits and vegetables all contribute towards a healthy diet. I have provided you with some of the amounts of fruits and vegetables that are recommended: 2.5 cups of vegetables and fruits daily. Use whole grains instead of refined grain products, and select food and drinks in amounts that would help in achieving and maintaining a healthy weight. But one cannot maintain that healthy weight with diet alone. Physical activity is very important, and actually studies have shown benefits from increased physical activity. It is recommended that at least the individual performs 150 minutes of moderate intensity or 75 minutes of vigorous intensity exercise every week. And these amounts of exercise or this type of exercises can be combined. For example, you can decide to do 2 days of vigorous exercise and 3 days of moderate exercise. That's what is meant by combination. More activity is better. Studies have actually shown that if you exceed 300 minutes for the moderate intensity activity and 150 minutes for vigorous intensity activity, that actually improves the decreased incidence of developing breast cancer. There's also recommendation for children and teens. It is recommended that they perform at least 1 hour of moderate or vigorous intensity activity every day. And for vigorous intensity, there's a recommendation of a minimum of 3 days per week. As you can see from the figure on the right, being physical activity actually helps various types of cancers. And as you can see from the first picture is the breast cancer that is indicated. I have provided here for you examples of physical activities. For moderate intensity activity, examples include walking, dancing, volleyball, softball, baseball, and so many different examples. Yoga is also included as a moderate intensity activity. For vigorous intensity activities, examples are jogging or running, bicycling, lacrosse, basketball, soccer, and other examples. If you must drink, there are recommendations on how much alcohol should be consumed a day based on sex. As you can see, limit intake to a maximum of 2 drinks per day for men and 1 drink per day for women. So what is 1 drink equivalent to? A drink is equivalent to a 12-ounce can of beer, 5-ounce glass of wine, and 1.5-ounce 80-proof hard liquor. This slide just shows you some of the drugs that are being used for prevention of breast cancer. Okay, and I would really recommend, oncologists would discuss these drugs with you. So if you need further information on these drugs, please contact your healthcare provider. I have provided you with a list of resources here that will help you to get more information on this topic. I would like to bring your attention to some of the references, such as the references provided the American Cancer Society resource. If you go to the website, it provides a lot of different resources, and that includes resources that will provide education, resources that will provide transportation, if you need transportation to and fro from treatments, financial resources, patient assistance programs. Also, if you go to the website of Susan Komen, which you can find on the following page, Susan Komen also provides you with a whole list of different organizations that would provide you assistance. I cannot provide you with all the information that you from these resources. However, I will encourage you to go to some of these websites and see what type of resources. There are a lot of resources that you can find on these websites. Going back to an American Cancer Society, their educational resources is available in several languages, including Arabic, Chinese, Polish, Spanish, Vietnamese, and so many different languages. Whenever you need some more information on this topic, please do not hesitate to contact your healthcare provider. So what is your takeaway message from this presentation? Breast cancer is a disease caused by several factors. Female sex and age are the most important risk factors. Some of the risk factors for breast cancer are modifiable, which can be changed by changing your lifestyle. Survival is greatly improved with early-stage breast cancer. Screening recommendations for early detection using mammography are based on risk factors and other considerations. Lifestyle modifications such as a healthy diet, physical activity, and limiting alcohol consumption plays a key role in breast cancer prevention. Resources are available to assist you with learning more about breast cancer. And also, just to emphasize again, if you need further information, please get to the websites that I've provided to you, or remember, always contact your healthcare provider if you have any questions about information on breast cancer. Thank you.
Thank you, Dr. Oyalowo, for an excellent, informative, and very resourceful presentation for the community. We really appreciate your time and your expertise. For more information for our future program, please reach out to our email at outreach@icius.org regarding the FAT initiative or any other information. With that being said, I would like to close the program on the final slide and invite you to next episode, Diabetes Awareness Month during November 2020. Did you know that November is Diabetes Awareness Month? Please stay tuned for the next episode in November. Thank you. Hope you can use the resource that we provide to take care of your loved one. Have a great time.